I am a dentist by trade, and I'm actually a prescriber of opiates. I was selected to go to the National Conference of State Legislature to look at some of the policies that could be changed to help solve some of the opiate problems that we have in not just our state, but in different states, and what some of the other states are doing. So it really depends on, in my opinion, there's different pieces. There is the prescriber, there is the patient, and then there's also the pharmacy. And so the key is to figure out, what policy will work so that you're able to get patients access to opiates when they need it without abuse, and to make sure that there is a system in place so that that if there are prescribers that overprescribe, that we can address those individually. Right now, so one of the things that they've done is they currently have a board that will wind up a database so that they'll track how much opiates are being prescribed. Part of the problem that we have with that is that there's very little communication back to the prescriber. So for example, me as a prescriber, I don't know if that patient has gone to 10 other offices. So the database would know that, but I'm not notified. So if you have a patient who is going around shopping, shopping for different drugs, you have no method in order to solve that. So that's one of the things that I want to work on, is to create a policy so that we can have the database so that the
what action is allowable on that database right now?
To tell you the truth,
is there any law enforcement ability to use that?
What do you mean? So for the law enforcement to access that, I do not know. I can get that back.
No,
yeah.
I was curious.
And so that's
I was curious if you, as a provider, knew that at all.
No,
what protections
no.
You
And
have.
so one of the things that they started doing was tracking, because before there was absolutely no method of tracking. In addition, for the prescriptions, there was so many areas that somebody could forge the doctor's signature or forge the prescription. So they have done some of those things to change it, but as we all know, when you have someone who is going to abuse a system, that they'll work and they'll find ways around it. So one of the other pieces is that right now, if you have a patient who's going around shopping for medications, and let's say they got the prescription from 8 different people, and they have a legitimate reason for getting the prescription, there's no method of, right now, I would have to actively go into that database to find out for every single person. And what I want to do is have that so that we can report back, and we can say, okay, wait a second here, this patient just got done going to 8 different providers, and they've got 8 different current active prescriptions, and that way that would be helpful for me as a prescriber.
Should that be your job, or should it be kind of an independent third party? And I'm saying right. Like sensitivity to privacy here, maybe more than...
Well, right now it's already on the database.
Okay, you have that ability.
So right now we currently have a database. The database is not being utilized as efficiently as it could be. So that's the first part. The second part is they've started actually getting drugs that have got a low, what is it called? I can't remember the exact words, but basically the amount of addiction quality is much lower for these newer drugs. And for me, that's something...
Newer prescription drugs.
Correct. So they're narcotics with a lower addictive component to it. And it's a deterrent that the chemical that they stick into the drug.
This is the pharmaceutical companies.
The pharmaceutical companies. The problem right now, though, is that they're extremely expensive, which is why they're trying to push it to the different states to have Medicaid and take that. But so moving forward, as they become less expensive, that's something that I would also like to get for our state.
So you talk about prescription drugs. What about heroin?
So we do have a huge heroin problem in our state as well, and to me, I feel like for some of those people, it started with the narcotics, because heroin is just a much stronger dosage of that. In addition, we also need to be able to have centers so that people can get the help when they do want to get the help. Because right now we currently do not have a current system that will accommodate the people who need it. And then in addition, of course, that also correlates with mental health. And unfortunately, a lot of people are self-medicating with, recreational drug use. And so we need to make sure that we're taking care of our mentally ill.
The Kitsap and Mason counties have both approved 0.1% tax increases to fund crisis centers to address the mental health kind of problems. Do you agree with those sorts of approaches?
So here's the thing, is right now we don't have a good system to where we can track someone who is chronically mentally ill. So right now, basically, for our state, we have different avenues that people can go once they're in crisis. But right now, we do not have a current system to where we can follow and track that person as they wind up and have preventative measures before they wind up going into crisis. And that was one of the bills that I put forward last year, which was right now when you have someone and they are chronically mentally ill, they wind up having an episode and they wind up going into jail, there's very little, if any, communication with the current mental health agency, and with the exception of King County. King County has got their own. Kitsap County, they have somebody who works part-time, and basically there's a lot of problems with that. And if someone ever goes, let's say that they're schizophrenic, they go off their medications, they wind up going to Kitsap County Jail, but they're from Spokane, there's no method to actually notify Spokane and say, hey, we have your patient here, and number one, and number two, that there's no follow-up. So what happens is that not only once they go into the jail system do they get taken off of Medicaid, a lot of times they'll say, hey, this person doesn't necessarily belong here in jail, so they let them go. They don't have a job, they don't have a car, they don't have they haven't taken their medications, and in addition, they're off of Medicaid. And so they'll get a piece of paper that says, congratulations, you are now, you're eligible for Medicaid. So they have to go back, reapply for Medicaid, go to their doctor to get the prescription, and then start taking the prescription. And we wonder why that person would wind up having another issue and going back into either jail or the hospital.
Where would that case management best reside?
So right now we currently have the BHOs. So that was one of the bills that I put forward, was basically saying that we have to streamline that and create a database system. So to basically notify the person or notify the BHO once that person winds up in jail. And it got overwhelming bipartisan support.
And a BHO is something like Kitsap Mental Health?
Correct. So if you have a
local mental health agency is a BHO.
So if you have Kitsap Mental Health, you have a Kitsap Mental Health patient, they go off their medications, they wind up getting in a fight over in Mason County. Right now there's no method of communication, no method to help track the person, which is why once someone winds up having a crisis, they'll go over and over. Usually they'll wind up having multiple crises in a short period of time that winds up costing us way too much money. So at any rate, I had a lot of the lobbying groups who had thought that it would have affected them, and they were not exactly too happy that I brought that forward. But
who would it affect?
So I had, there were about 12 different groups that came forward.
What type of agency?
So we had let's see, there was Walk Hops that was involved. We had the Hospital Association that got involved.
They don't like it?
Well, first they didn't. Okay. So then what happened? So I said, okay, fine, let's table this. And over the interim, I've held numerous meetings with all the different stakeholders to figure out what exactly that their problems were, because this did get an overwhelming amount of support. One of the things that they thought that it was going to cost way too much money, come to find out we already currently have a system within the police system to track people once they enter the jail system. In addition, what we found out was that there's federal dollars that will have a 90% match. So we're going to be able to get this system in place for our state, And they're saying that they may not need a whole lot of money. If they do need anything at all, that the agency may be able to, DSHS may be able to absorb that cost. And so that's one of the things that I'm working on, is to have that go forward so that we can have a system in place across our state, so that if someone who's currently chronically mentally ill has a crisis, regardless of wherever they're at in the state, that then the BHO, their provider, gets notified, and then they can go and either follow up on the person, make sure that in the jail they're getting the adequate medications, and hopefully prevent future instances. And so to me, that's one of the things that I'm trying to work on. I feel like we have to take care of our mentally ill. We're not currently, and part of that problem has to do with the fact that we have different silos within our mental health system that winds up caring for people only when they have a major problem. And in my opinion, I think that we need to take care of them, and we need to make sure that I think that it's a whole heck of a lot cheaper to take care of them and follow them through and make sure they're getting the medications that they need, and preventing more crises.
Part of that is funding for local agencies too, I would imagine. That's what Kitsap Mental Health is facing here, with having to do layoffs this summer and getting caught on that. Is that the legislature's priority this year? It
actually is, and we did wind up adding more funding for mental health in addition.
Western State.
Western State. Correct. And that's what I was saying before. And so the other problem too with Western State is, quite honestly, it's not being ran well. And there are multiple problems within Western State. I went and toured Western State. One of the big problems that they got cited for was because if you have someone who is combative, okay, and that's what happened, was that they had someone who was combative. They had no way of making sure that they were protecting that person from the employees or from other inmates, and that person wound up attacking one of the inmates. So that was one of the citations. Well, even when
more than once?
Oh, it happens all the time.
I mean, to the same person.
So there was one instance in particular where there was a person who, if I remember right, they were being restrained. I need to review it because it's been quite a few months. But when I had gone and toured Western States, it was months later. They still did not have a system in place to protect either the employees or the patients if you had someone who was combative. Because some of those people, I mean, I do nursing home care and I work with people who are dementia. Of course, I'm very blessed in the sense that, a 90-year-old, if they get combative, is not very strong. Well, if you have a 30-year-old larger man, I mean, they can do a lot of damage to somebody, and they have. And that's the other thing too, is that the incidence or the prevalence of people, the employees, and them getting attacked, that was huge. And so as a result, they have not been able to retain quality work. So this is,
there's two.
Well, one of the biggest things is that you have to make sure that you are adequately protecting people. So for those for example, for that one particular thing, that they need to have an area so that they can properly put the person in there so that they're not hurting themselves and that they're not hurting others. And that should have happened a long time ago. So that was one of the problems that Western States had. It was not necessarily a funding issue. It had more to do with that. But in addition, because of that, it's actually wound up costing us so much more money because people are leaving. And on top of that, we're winding up paying for injured employees. I mean, a lot of this is very preventable. So
you feel that addressing the safety?
Yes, I think that is one of the biggest.
Would allow for cutting the turnover, retaining people. What about the leadership side of that question?
So I know that the leadership has changed. When I came there, that was right when the leadership had changed. I don't want to, for me, it's kind of hard to gauge how well someone's doing when they've only been there for a couple weeks, and I had gotten there right when the leadership change had happened. I do know that, so I don't want to, make a statement on the new leadership without seeing exactly what's happening. And quite honestly, I have not followed up on that. I know that there's still instances coming forward with Western states, but to me that's one of the biggest things is that until the safety piece is addressed, that we're going to continue to have those problems in Western states.
Now, do you think that the ideas that are going on in Kitsap and Mason with the local sales tax, building crisis centers, evaluating projects, kind of that type of a system, is that a good idea? Is that an effective way to treat this, or does it need to come, okay, we do this as a state and this is how we work?
So I think that there's different pieces that need to be done as a state and different pieces that can be done locally. And one of the other things that in my opinion needs to be addressed is the DMHPs, the designated mental health professionals, because those are the ones who determine whether or not the person becomes, gets detained, so that's part of the problem, is that you can have, there's been instance after instance where family members will bring in a patient who is in crisis, and they say, hey, please help me. And the designated mental health professional says, well, they're not quite to the point where that they're going to hurt somebody, or they're going to hurt themselves. And so as a result, they wind up letting the person go. There is absolutely no system of checks and balances as to whether or not the designated mental health professional is adequately evaluating. And in addition, we can look back and there's case after case after case where people have gone in to the mental health facility and have not, been sent away and either committed suicide or wound up hurting others. And so to me, I feel like that's another piece of the puzzle that needs to be addressed on a state level. And that is something...
The standard is that the person has to be in imminent danger to themselves or others at that moment.
Correct.
So it may not be the professional that is the cause. It may be something that the pendulum is swung too far towards the patient's rights.
Correct.
So do you see anything being done federally or in the state legislature to correct that?
Yes, and so in the state, that was one of the things with Joel's Law, which in my opinion did not go far enough. But one of the things with Joel's Law is that it allowed families, and this had to do with the designated mental health professional, to allow families to take that to court and to overturn their decision. Of course, by that time, a lot of times it's too late. But to me, I feel like there's two pieces. Number one is that the pendulum has swung too far, because obviously, if you look throughout history, there were times where people's rights were taken away, and maybe that they were not, they didn't deserve it. Maybe that they were depressed, or they had marital problems, and especially with women, they wound up being incarcerated or detained, and had a lot of their rights taken away, which should not have happened. And so unfortunately, in my opinion, you're right, the pendulum swung way too far to the other side. And I think that needs to get reined in just a little bit, as well as making sure that there is a system in place in the event that the designated mental health professional winds up not having, they have poor judgment. I think because I've seen people who are addicted to heroin, and honestly, you need to have something. I think it's their bodies go through withdrawals, and I think to have methadone in place to help for a transition, I think that's a medication-based help.
Sure. Are you supportive of the drug? I always pronounce it incorrectly, but Narcan. That deals with overdose situations that
yes.
First responders are now carrying. Do you support the first responders carrying that, and should that be expanded at all, whether it's in schools or in homes or to residents?
I would like to see that expanded if there was training involved as well. Well, honestly, they need some sort of treatment. Unfortunately, right now, I don't think that we have good avenues for that, number one. Number two, but then again, you kind of have to make sure that the person wants it. You know, I mean, you can lead a horse to water, but you can't make him drink. So for me, I feel like that should be an option for a person, is to either go through drug rehab or to wind up going through the to get punished another way. You know, and in my opinion, I don't necessarily think that the jails are helpful. The only thing the jails are helpful with is I think that they're just not able to get some of the drugs that, you know, that they can get on the outside. It makes it more difficult for them. But so to me, I feel like when you look at the homeless problem, you have to look at why is somebody homeless. And for the people who are chronically mentally ill, and you know, I feel like we definitely need to make sure that they've got homes available for them, that we're housing them and taking care of their mental health issues. For Utah's a little bit different in the sense that they've also got the church-based, so the church winds up taking over with some of the problems. So when you have someone within the church who's got a crisis, the church steps up to the plate, and so a lot of times that they can help prevent some of the homeless problems in that aspect. One of the problems that has happened with the Utah model is that there are people who will wind up taking advantage of certain policy and certain things, and that's one of the things that I've been told has happened with Utah, is that they've had attracted people from other states to come there, and so that's one of the problems is that if you have this super great model where you say, hey, regardless, you get home, well, you're going to wind up attracting other people. We have some other issues. Okay, so with Seattle, they have dumped a lot of money into the homeless problem. Part of their problem is that it's quite honestly, it's extremely expensive to live there, and the other piece of the problem for Seattle is that even if you get somebody where, let's say that, you know, they're struggling, let's say that they have a job, they can't make ends meet, they can't afford a place to live, and so they're on the street, you know. So you give them a home, or you take care of that, and let's say that you can get them so that they're working at you know, some other job, let's say at a restaurant. They're not going to be able to make enough money to live in Seattle. So that's one of the problems. In my opinion, if we do a statewide approach, it needs to be in some of the other more rural areas where you can have somebody where if they don't have the ability to get a very high-paying job, that they can wind up, you know, we can help with some of their other issues and making it so that they can wind up being successful once they leave, because that was the whole piece, is you give them a home first, and then you work on some of their other issues, and then make it so that they can function outside. Well, in Seattle, I mean, you can't live and get a place to live there, and if something were to ever happen to that person, a hiccup here, car breaks down, they're going to be back to where they're at before, and that's one of the problems. And so for me, I feel like you have to really address what the problem is. Either A, they've got mental health issues, or B, which is what happens with a lot of people, is that they have low-paying jobs, and something happens, either an injury, car breaks down, something like that, and they can't afford to live.
Are you in favor of the minimum wage increase?
No.
You're talking about people who can't afford to live.
Right. So here's the thing. Here's the reason why. Is because when I was 17 years old, I was working 3 minimum wage jobs, and I was taking care of my sister and her friend, and I was in support of the minimum wage. And so, minimum wage went up. Sure enough, everything else went up. That same day, Kentucky Fried Chicken prices went up. Everything else went up, and I was still poor. And so for me, I feel like you have to have a pathway out of there. In addition, some of those minimum wage jobs, those are things for a lot of the teenagers that will start off with a kind of a training job. And quite honestly, that's one of the things that helped get me out of poverty, was to have that base, and then to be able to go and get an education and get a different type of a job.
It wasn't meant to be a living wage. It's what it is. It's a minimum wage for just what you're talking about.
Exactly.
Support a family on that kind of thing.
So how do,
Correct.
well then how do you help those folks that you're describing? We're trying to get them in housing, we're trying to get them to transition to something, but like you said, what car breaks down,
right.
it's over.
So to me that there's a couple different pieces, and we do have some things to help people. So one of the things that I do support is an earned income credit, and that is something our state does. And you know, basically as you work, then you know, at the end of the year, I would wind up getting additional dollars back that was helpful to help kind of level things out just a little bit. But really, it's not designed to be a living, you know, a family supportive wage, and it's a stepping stone. And in my opinion, one of the things that made me get out of poverty was being able to have skills and to be able to get a job to where I can utilize those skills. So one of the interesting things is that for the last couple decades, we had one party who had control over the House, the Senate, and the governorship. And those are the ones who are claiming that these are the most regressive tax structures. So that, what is it called again? The
Institute of Taxation and Economic Policy.
Right. So that happens to be a little bit more of a left thing. And so when they talk about regressive taxes, so basically anything that's done on consumption is considered quote unquote regressive. Okay. I don't necessarily agree with the current tax structure that we have. One of the other things is when I was poor and working, you know, minimum wage jobs, you know, even though they say that the poorest are paying so much more, quite honestly, I wasn't paying very much in taxes at all. Most of my money went to rent, it went to food. I didn't, you know, other than gas, you know, but for the most part, I wasn't paying as much as I am now. I'm paying considerably more of my percentage of my salary in taxes now than I ever did before. So I don't necessarily agree with this whole thing of, you know, the poor paying more of a percentage. So I don't agree with that piece. So number one. Number two, the other piece with that particular group is that one of their things is to kind of put into a state income tax. I do not support a state income tax. That's one of their whole things, is to say that this is a non-regressive tax because you're taxing it on income rather than consumption. I disagree with that. I don't think that the people in our state have overwhelmingly voted to not increase taxes. They do not want a state income tax, and I am very much against having a state income tax. The other piece that they try to do is to tax in terms of you know, what things that help the economy grow. So they say, okay, well then the all the businesses we need to increase the B&O tax. Well, quite honestly, the B&O tax, in my opinion, is also not a very fair tax because it goes off at the top. And in addition, as we start increasing the B&O tax and making it so that it's super heavy in that aspect, what happens is that our state becomes less competitive for other jobs. So when you have a national company and they're looking at, okay, so should we decide to have set up work in Washington or set up work in Texas, you know, I mean, the greater that we increase it to try to quote unquote stabilize the income and make inequality better, that it winds up hurting us in the long run.
So what tax structure changes would you like to see? You just mentioned you're
not all happy with that. And so here's the deal, is that the way that I look at our current tax structure is I think of it a lot like our ecosystem, to where if you start unraveling one little piece, and it affects so many other pieces. A lot of the way that we have it right now, you know, so for example, you know, people say close the loopholes. Well, one of those is not having a sales tax for food. I don't think that we ever should have had a sales tax for food, so I'm not going to be supportive of that particular closing the loophole tax. So, so for me, I'm not on appropriations. One of the things I would like to do over this is I'm hoping that I will be put on appropriations, and I don't currently have any solutions as to how to fix the tax structure.
That thing you mentioned about closing loopholes, that's it's a boogeyman that it comes up every single time.
Oh, it is.
Because
Yeah.
it's real easy to say, well,
Yep.
we only do this, we do that. Do you agree in any part with that comment? That we could get money back in the state account to pay for some of this mental health, drugs, education? Do you believe there's money there to be found? And what would be the approach to, how do you evaluate these things?
So there is money, but I don't believe it is enough to fill whatever void that different people say that there is. So
Is it worth looking into?
Oh, absolutely, absolutely, and they look into it every single year. Every single year on appropriations, you have all the different lobbying groups, and they say, okay, well, you know, so for example, the Port of Tacoma, they have different preferences for different things as they come in through the port, and you know, so of course they say, okay, well, these tax preferences were put into place a long time ago, and if we wind up if we wind up removing those tax preferences, then we're just going to lose all of that revenue altogether, because they're going to wind up going to it through Oregon, you know. So that's the other piece is to say, okay, is to really look at it and say, okay, well, you know, so what does that look like? I was on education, healthcare, and general government IT. So the way that the legislature is set up is that you're put on the different committees, and those are the ones that are your primary focus. So with the appropriations, they did go into the detail of every single one of those tax preferences, and you know, having those come up every single year. And so for me, and you know, to say, okay, well, this one particular one, that's the one that we need to close. I don't feel comfortable saying that at this time.
Are there any that bother you? You know, sometimes some will have like a glaring one that's glaring.
Right,
that says,
and then they're like, it would have
given
given us $10 million.
Something like that.
Yeah.
You don't see that existing.
I don't think that it's a silver bullet. I honestly don't. I think that
Well,
that if we do have tax if we do have tax reform, then that's something that we definitely need to look into and make sure that, like I said before, it's an ecosystem and that you're not doing one thing and having all these unintended consequences. It depends.
Okay.
So
more than a yes or no answer.
Yep.
Go ahead.
Yep.
Tell me why.
Okay. So here's the thing: is that I always feel like there's different talking points, and so you'll have different groups, and they say, okay, this is what we got to do. This is what's going to solve it. You know, we just need new revenue, or we need this, we need that. You know, there's a regressive tax. We need to have a new budget. I actually do favor having a separate education budget so that we can look at that. However, if that it depends on how that's set up. If that's set up. You know, so to me, I feel like it really depends on how that is set up.
You mean on how is that in terms of what else it takes away from? Is that what the catch is?
Right, that and actually what that looks like. And to me too, I feel like a lot of that has to do with you know, so when it comes to the legislature, does that mean that the education committee winds up being the one to do that?
Oh,
you see what I'm saying?
Because then they suddenly try it.
Because part of the problem that we have with the education committee is that it's a policy committee. So then they say, okay, well, it's a policy committee, so even though there's all these policies that are going to be taking effect that wind up costing money, we just don't deal with that.
We don't care about
when really and then they swipe that off onto appropriations, and they say, well, appropriations can just deal with that. But it's not fair. Because quite honestly, if you're passing a policy and it winds up costing the state $200 million, that should be part of your decision process, right? I mean, it's kind of like everything else, like in your house. So if you say, you know what, I want to have this, that, or the other thing, but you take into effect, okay, well, if I buy that couch over this couch, that costs more money.
Like
and so that's part of the decision.
Like
so if you just say, well, if you had, you know, don't look at the money, which couch would you rather have? And that's what they do for the education committee. That I don't like how it's set up. So to me, that's one of the other pieces is what does that look like? And so if that's the case, and if the education committee is going to take that as a whole and say we're also going to be doing the budget, and to figure out and make sure that it doesn't necessarily swipe other things, because I always feel like in Olympia that there's real problems and then there's the political piece. So if putting a separate budget together means that the political piece is going to come into place to make that not work, then I don't support it. So meaning that it says, well, we have to fund education first, regardless of anything else. And, you know, so we can sweep the, you know, take all the money away from mental health. Well, I don't support that.
You can't. The Supreme Court said you can't.
Right, exactly, exactly. Well, so I guess for me that I do, as long as it is something that makes sense and it is fair.
Makes them accountable to it.
Right, and then it goes through the education committee so that there's not two, sorry, there's not two separate committees making decisions that don't talk to each other, because that's what happens right now.
So Michelle, where is the shortfall? This 5 or 8 billion, whatever the number is, where's that going to come from? How is that going to work?
Okay, so here's the other thing. I don't necessarily agree that there is that big of a shortfall. So right now in our operating budget, 48% of it goes to K through 12 education. So if you include the local levy dollars and the federal dollars, we wound up on average, it was $12,000 around per student per year. So that means that there's 300 for a classroom size of 25 students. That's $300,000. There was never a decision as to how much it cost for basic education. We never got a dollar amount. So part of the problem is that there is way too difficult to track the dollars once they leave the legislature to making it to the classroom. That's to me, that's the biggest piece. And before we ever go back to taxpayers and say you need to pay more money, that we need to make sure that the dollars are actually making it to the classroom, because right now, quite frankly, that they're not. In addition, there's inequalities. There's an 11-page formula as to how they determine which school gets which funding. So some schools get around $50,000 per student per year from the legislature, and some only get $6,500. And there are basic inequalities with that in general. And so to me, I feel like that 11-page formula, that's one that definitely needs to take into consideration.
Would the property tax levy, that equalization swap, address that?
I don't believe so. So first of all, that's just the piece that comes from the legislature. So that's the funding that comes from the legislature. So the other piece too, like I tried to track where the MSOC dollars were going, you know, and that's the other piece too, is that the school districts don't necessarily have to report back where they spend the dollars either. So we allocated $1,218 per student per year for MSOC dollars, and I tried to track the dollars.
What is MSOC?
Oh, was it maintenance, supplies, and operating costs. So, so basically, because the teachers were complaining to me that they're paying money out of their pocket for supplies. I said, well, wait a second here, because I just approved, you know, I voted in favor of that budget. It was $1,218. So if you have a classroom of, you know, 30 students, right, that's $37,000. So why is it that you're only getting $150 or $200 for supplies? To me, that is absolutely ludicrous.
What was the answer?
We could not, I worked with the office, the OPR staff, they could not track the dollars because they're not required to report them back to us. And so that's the other piece of the puzzle. So if the legislature is completely responsible for the funding, then there needs to be, we also need to be, have communication between the transparency, making sure that the dollars are going to where they want. Because right now we say, okay, so here's money, you go spend it, you have local control. Of course, then we have absolutely no, you know, that wherever they wind up spending the money, that we have absolutely no control over that, and then they'll continually say there's not enough money. So my whole thing is...
So that's because of OPS, the Office of the Superintendent's Office, that you're not getting all the information?
Well, that's part of it. They're not required to either.
Well, why aren't they required to?
I didn't put the system in place.
But can it be changed?
It absolutely can be changed.
It sounds like it should be.
And that's what I'm saying, is that those are the pieces that need to happen before we ever go back to taxpayers. I don't think that the system is a good system right now, and it's something that's been in place for a long period of time. It will take time to change, but to me, I feel like that's one of the biggest pieces that we have to look at. When it comes to the levy swap issue, I don't support that, and here's why. Is because right now, when we have Mercer Island, and Here's the other piece. The other piece of the puzzle that's the problem, and that is that there's basic inequities for all the different school districts and all the different areas. I mean, really, it's not confusing that the kids that go to that are in Bremerton School District, they're lower socioeconomic, they have greater needs in general, and you know, and whereas the kids in Mercer Island, a lot of them, they have two parents where they are educated and they provide a little bit better support for their children. They have come from more affluent backgrounds. So there's those basic inequities that, in my opinion, some of those things we will not be able to fix. Okay, however, for Mercer Island, their levies pass, and the reason why their levies pass is because it winds up going to their local school district. That was the whole point, was they say, okay, well, we're willing to pay more in property taxes because we want the money to go and to help support our children. So in the event that we do the levy swap, what I think will happen, because I think that human behavior is, I think it's sometimes quite predictable. If Mercer Island knows that their dollars are not going to go help Mercer Island, but instead to go help Bremerton, I don't think the levies are going to pass. And I don't think that,
Isn't that the idea is we would get off levies though, right?
Well,
isn't that part of the idea? We don't want to be paying local levies anymore.
That's right.
I don't think we should. I think that we should figure out what that dollar amount is from the legislature.
You worry that would come up anyway.
Oh, it will. Well, because that's the thing, is that if we rely on and say, okay, well, that's the silver bullet. The silver bullet is a levy swap. You know, that we'll just take all those property taxes, we'll mix it up into a pot, and then redistribute that. Because that's basically what it does.
So I'm going to say it back to you. Just, I'm simplifying it, of course, but I don't know, maybe it shouldn't be the silver bullet, but what would be important would be if you could see the accountability of how all these things are spent. And then if it's short, if that's how all our money is spent from the state, it adequately gets to the classroom, like you're saying, it gets teachers paid, whatever else, and if, let's hypothetically, but it doesn't cover new buildings, we know what it is, then you're okay saying, okay, voters, that's how much we need to come up with, having a conversation about that.
Correct.
Kind of what you're,
correct.
That's what you're
correct.
going on. Okay.
And so in my opinion, it needs.
But you can't do that until you see.
Exactly. And that's the thing, is right now that the dollars are not getting to the classroom, and before we can ever have a conversation as to how much that is. And if at the end of the day we say, okay, well, this is what the dollar amount is, but right now it's not being, you know, our educational system is not efficient at all.
Would you like to see teacher salaries negotiated at a state level?
So that's the other piece, is I think that so right now we have a problem where the local school districts, they'll blame the legislature, and then the legislature then in turn blames the local school districts, because they say, well, hey, we funded for X amount of dollars according to our formula, and then the school districts say, well, that's not the formula that we use. We have a different formula, we negotiated something different, so you have to pay us more. So my whole thing is that you can't have it both ways. You have to do one or the other. You know, either decide we want local control, and in that case, then we say, well, this is what the funding dollar amount is, and have those negotiated on a local level, or you say that the state legislature is held completely responsible for it and allow them to do the negotiating. I'm more of a local control person, so I would prefer for that to happen. However, I also don't have control over the whole place.
How much chance, as someone who sits on this education committee, how much chance is there of getting some of what you're saying into written legislation?
I don't know.
As far as the accountability part, do you think is that reasonable? I mean, it seems like a fairly straightforward question to put forth, right? Do you have any hope for it?
So that was one of the bills that we passed actually last year. Was to make it so that there was a little bit better transparency as to what the dollars were, and better tracking, because right now that was part of the problem with the McCleary task force, which I'm not on. Senator Rolfus is on that task force, but basically saying, well, okay, well, wait a second here, you guys don't even have what dollars go to basic education. There's nothing there. So how do we know if we're adequately funding what's quote unquote basic education? And then that's the other thing too, is that it hasn't adequately been determined what exactly is basic education, especially when it comes to teacher pay, because, you know, what's basic and what's quote unquote extra, that those things have not been.
Do you have any quick opinions on the definition of basic education? Do you generally agree with what's there? Do you think it's missing something? Do you think there's something in there that shouldn't be considered?
I guess I don't understand.
What?
So, I don't understand the question.
How basic education has been defined thus far, and I know there's still discussions over it. Is there anything in there that you say, you know, that's great, but that's not what we should be paying for? Or on the other side, you say, you know, we really should include community college too, or we really should include, you know,
I think that,
are there any, do you have any?
Yeah, I know that there's a lot of proponents who want to add kind of the housing first model to basically say that should also be added to. In my opinion, I think that basic education needs to be as small as possible so that we can actually fund that first. You know, I'm a huge advocate of actually doing what we're supposed to do before ever going back and saying that we're going to pay for something else.
Okay, Michelle,
yes.
The superintendent currently is suing 7 different school districts over their use of the special levy funds. Would you comment on that? Because, I mean, I got to tell you, we're hearing stuff right now today that we haven't heard from anybody else that's been here. So it's kind of enlightening as far as I'm concerned. And what I'm a big advocate of is trying to find out what the truth of any of these issues is. Because all we have is, nothing against the newspaper, but we have the newspaper, we have the television, we have the radio, and go back to my
So, okay, yeah, because see, part of the problem is that they'll have different talking points, and you'll have different groups that say, okay, well, this is our talking point, or this is what we've decided, and for me, that was not acceptable. So that was one of the things I did, was we have the Office of OPR staff, Office of Public Research, and one of their jobs is to help make sure that we have adequate information. And so I spent hundreds of hours with them really trying to track the dollars from once they left legislature, because I was quite upset with the fact that we just approved $1,218 per student per year, but then the teachers are still having to come out of their pocket. So why is there such a huge discrepancy in Olympia versus what's going on the ground level? And so that's kind of, for me, like why I probably am not saying exactly the same thing as everybody else, you know. When it comes down to the Office of Superintendent of Public, Randy Dorn suing the schools, okay, first of all, I agree that the schools are not utilizing the levy dollars, what they're supposed to be using.
It's unconstitutional to use that, according to what we read in the paper, for teacher salaries.
Correct. However, at the same time, I don't know how helpful that is. So remember when I told you before that there's real problems and then there's the political piece. So to me, I feel like I don't see how that's going to help our state to spend a bunch of money in court, you know, fighting that. I think that we can sit there and say, and also too, why is it that he's doing that right when he's leaving? You know, to me, that's kind of more political grandstanding than anything else. You know, it's actually, they've been doing the same thing for years. So why now all of a sudden has he decided he wants to go sue the school districts? To me, that I feel like that's absolutely ludicrous. If he really wanted to work on the problem, he should have worked on the problem a long time ago and said, hey, you guys are not doing what you're supposed to be doing, and having, you know, maybe, you know, having an investigation done or something like that, and say, you know, hey, this is what my recommendations would be from the Office of Superintendent of Public Instruction instead of
Michelle,
putting
I'd
it in
like
court.
to get back to what you were saying about basic education should be as small as possible. So it sounds like what is it? What is basic? What is that small as possible?
So what I meant by that was that there are different people who are saying, okay, well,
okay, I understand there's different people.
Right.
What are you saying? What are you saying is basic education? Since you think it should be as small as possible so that we can make sure we are funding it. So what is it?
I guess I don't.
So I wanted to get, I mean, because you're talking about that, you know, you don't want to, what is basic?
She's countering the idea. Go ahead.
Yeah, so I guess I don't understand what
you're trying to explain this.
So what I'm saying is that there's different groups that come forward and they say this should be added to public education or basic education, and I disagree with that. I think that what we currently have
we can't afford to keep adding.
Yeah, we can't afford.
We can't afford to keep adding.
Keep adding. I think that before we ever decide to make more promises to people, that we need to fulfill.
So what is it? The things that we should fulfill? That we're not, are we fulfilling, are we already fulfilling the things? Do you think we're already, if we just look at the smallest possible definition, that we have adequate resources and we're pretty much fulfilling the mandate?
What I'm saying is that there are, right now, that there are huge inadequacies that we have throughout our state. So there are many areas that we're not fulfilling that.
Such as, I'm just trying to get some examples.
We may have to email this if you'd like.
Okay.
I mean, Martha, I guess I don't. But it's, I don't know if you're asking her to list everything.
I'm just asking for something more specific. It seems a little bit, you know, I guess I'm just not sure I understand what are the inadequacies. Is it just the inequity, or is it that?
So there's basic inequity pieces that across our state, number one. Number two, the other piece is that the formula, the funding formula that we're utilizing goes off of the prototypical school model. So part of that problem is that they assume that children come in groups of 20. And so this is part of the funding problem that we have, is because the dollars are based off of, the fact that this prototypical school model, which in my opinion is extremely flawed, is so that the children come in nice little packages of 20, when in reality you might have 50 fourth graders one year, 30 fourth graders another year, and then 17 the following year. And as a result, those school districts are busy trying to figure out how to adequately split up those kids and make sure that the classrooms are sustainable. And so I guess for me, that I feel like that's part of where the inadequacies lie. And then what happens is that they're forced to pay for certain things first, and as a result, other things wind up getting left behind. And what I mean by that is that, for example, making sure that there's adequate counselors, nurses, and other support staff. A lot of times those aren't taken care of, or what will wind up happening is they'll wind up paying for those, which let's say that there's a classroom of 34 students. So what do? Do you decide that one teacher gets 34 students that year, or do you split up and have two teachers doing 17 students? And so as a result, because of that, because then the school district has to decide, okay, well then instead do we just pay pay for the teachers, then we maybe don't have enough money for taking care of transportation costs or taking care of the schools and so on and so forth. So I guess I don't
So maybe we should be spending less money on support staff. Is it?
No, I never said that.
Oh, okay.
No, what I said was that right now that the funding formula is flawed, significantly flawed. And so we either need to decide, okay, so if we have local control, we need to figure out what that is per student per year, and then give that to the local school districts and say, here you go, this is your school district, you figure it out. The other piece is that there needs to be an incentive for some of these other school districts to maybe come together. So for example, there's some school districts where there's only 5 students in that school. So as a result, some of their costs are heavily weighted because they still have to have the building. In addition to also implement other things like, for example, technology. So one of the other pieces that I'm currently working on is like for our foster youth. Right now that there is, because of the McKinney-Vento Act, that children are, when they leave the school district, a lot of times for the foster care, they are not in the same school district, and as a result, that initial school district is required to provide transportation costs. So those are some of the kind of the quote-unquote unfunded mandates. And so right now, then the school winds up having to pay for those transportation costs for those children, which is to pay for a taxi to go from Bremerton to Tacoma. That's quite expensive every day. So one of the things that I'm going to be putting forward for next year is to implement technology and allowing the school district the option for the rest of the semester to have to pay for iPad or something along that lines, and to allow the child to remotely still stay in school instead of having to pay for those transportation costs. And to me, I feel like as we move forward, that we either have to decide, okay, well, is this all going to be done on the state level, or is this all going to be done on the local school level, and solve it that way. But to me, I feel like that's part of the problem. Well, I feel like, for me, one of the things is that, first of all, I'm willing to work with pretty much anybody. I'm very proud that I was nominated by one of my Democratic colleagues for bipartisanship through the Seattle City Club. And to me, I feel like that some of the problems that we currently have in our state, that there's different points of view, and that I feel like I can work very well with others in order to accomplish that. You know, and to me, I am not a big political person. I feel like I can get down to the root of the problem. I spend a lot of time making sure I understand what exactly is coming before me for the legislation. And you know, I think that I'd like to continue to serve the 26th district, and I think that you know, I've always had open door policy and welcome anybody. So.
Well, thank you.